Did you know this podcast is powered by Acast? Acast is the home of podcasting. For creators looking for freedom to grow their listeners and make money too. And creative brands looking for smart ways to advertise. Podcasters and advertisers in the know Acast. It's time you did too. Visit acast.com to find out more. Acast, for the stories.
A new report out from the Health, Quality and Safety Commission in New Zealand has outlined Pacifica are at the tail end of the country's worst health inequities. The report, Bula Sautu, called the healthcare system unacceptably racist. With the government's planned mega-entity Health New Zealand to do away with the postcode lottery of who gets quality care, professionals are shouting out for help now. And they say this shouldn't be just another report that repeats the same harrowing figures. Marina Whangawa-Mola reports.
In Fijian, Bula Sautu is an expression of good health that has lived to its full potential, a life of abundance. It's the name of this report showing anything but good health. Pacifica are 12 times more likely to be diagnosed with a mental illness than other populations. Pacifica experience higher cases and deaths of breast, lung and uterine cancers, but the lowest rates of screening. 63% of Pacifica 5-year-olds have tooth decay, compared to 31% of non-Māori non-Pacifica. And more than half of pregnant Pacifica women are left without midwives, compared to just 19% of non-Māori non-Pacifica. The Bula Sautu report shows some of the worst inequities in New Zealand's healthcare system, calling it a systemic failure of human rights and a national shame.
It obviously isn't working because of the fact that CHBs are really struggling in maternity services because of the medicalisation of birth is skyrocketing, and the cost to our women and our whānau is really costly as well.
Tish Taihia is a New Zealand-born Samoan midwife of 22 years and manager of Ngā Hau Mangere Birthing Centre. She says expectant Pacifica mums don't know how to find a lead maternity carer outside of hospital defaults, and they aren't provided with culturally competent midwives.
If they're low risk and they can have a midwife as their LMC and care for them and birth their baby and go through the whole gamut of postnatal care, then it's up to them to they have to actually go and find the midwife themselves. And sometimes that's daunting.
Health Quality and Safety Commission board member Colin Tukui Tonga says the figures aren't good enough, but he doesn't want Bula Sautu to be just another report rehearsing numbers.
Certainly another report that doesn't lead to any action is not what is needed. The district health boards and the primary care providers, not Pacific, but everyone is held to account for making those changes. I just think it's unacceptable and unfair.
Amid government reform, which will merge the country's district health boards into a singular entity, Mr Tukui Tonga says the groundwork has been laid out to transform Pacifica Health. Otherwise, there'll be a continued decline.
We will have pregnant Pacific women not being able to access midwives in the numbers that are comparable to other parts of our community. We have children continuing to miss out on vision and hearing testing well child checks. We'll have Pacific people with diabetes continuing to have blindness and amputations and kidney failure.
Pacifica doctors make up just 2% of the entire health workforce. Bula Sautu co-author Api Talemai Tonga says universities and polytechnics must encourage more Pacifica students to fill the gap.
Medicine or healthcare is being practiced as the one-size-fits-all. You go to your doctor, you're told your blood test results, you're given a prescription and out you go, without any emphasis on the quality. Does the person sit in front of me really understand what it means?
The report lays out that the system is racist and systemically biased. Mr Talemai Tonga says it's a call to action.
I feel for our people. We go along, we see the doctors, we get the medications, yet we're still not getting the same level of benefits as the rest of New Zealand.
Despite several national policy statements and strategies, nothing's dramatically improved the health and well-being of Pacifica. It's hoped that Bula Sautu will be the desperately needed stake in the ground.
What's new in podcasting? Here's what we love, courtesy of Acast Recommends.
The Civil War was the most important event in U.S. history. That's because it decided what kind of nation America would be and whether or not America's promise of justice and liberty for all would come true. And what decided the outcome of the Civil War was its battles. I'm Scott Rank, and I'm the host of the show Key Battles of the Civil War. I'm joined by history professor James Early, and we look at the battles of Gettysburg, Antietam, Fredericksburg, Chancellorsville, and much more. And although the Civil War ended generations ago, with the 160th anniversary of the Battle of Bull Run coming up, in many ways the effects of the war live on to today. Subscribe wherever you listen to your podcasts.
Acast recommends.